Prince William is staying by the bedside of his pregnant wife, the Duchess of Cambridge. Cameras captured the prince arriving this morning at the Central London Hospital, where Kate is now being treated for a severe form of morning sickness. She's expected to stay at the hospital over the next couple of days. Doctors say if untreated, her sickness could become serious because it can cause dehydration, malnutrition, and other serious complications. So to better understand what she's dealing with, Dr. Sara Pierce, who is an OB/GYN with the Community Physician Network, is here to tell us a little bit about the sickness, and then also Kate Shepard, a local mother who has a beautiful baby, Joey, who was diagnosed with the condition. She can tell us what it was like firsthand. So we'll start with you, doctor. Tell us, what is the name of this condition? It's very unusual. I'm not familiar with it. And then what puts you at risk, and how long does it last?
Well, the severe form of nausea and vomiting pregnancy is called hyperemesis gravidarum, and that's what I hear through the media that Kate has. Nausea and vomiting pregnancy is actually very common. Most ladies will experience it at some point, but only less than 1% have that severe kind where they need to be hospitalized, have IVs put in, and have other forms of treatment.
And what puts you at higher risk for this?
Although it can be associated, and most often is associated with normal pregnancy, twins or even triplet, more than one baby can put you at risk. Also, there are some abnormal pregnancies and thyroid disease and some other rare medical problems that can put you at risk as well.
How long is it that you'll typically see that they'll be having these active symptoms, maybe being in the hospital?
A lot of times you'll find out people are pregnant because of their nausea and vomiting. It usually peaks around 8 to 12 weeks, and then is usually almost gone by 20 weeks. Rarely you'll have somebody who deals with it their whole pregnancy.
All right, so Kate, it sounds like maybe you had a really bad case.
I did. It was very severe. My nausea started and my vomiting at 4 weeks, and it went right up until the day I delivered. There was just no relief, and I was in the hospital and kept for several days, twice during my pregnancy.
And you had a healthy baby?
I did. He was very small. I had lost almost 30 pounds by the time I delivered, and he was 5 pounds when we left the hospital. So he was very small, but he was perfect.
What did you think when you heard that Kate, the other Kate, you being Kate as well, has this as a diagnosis, that you shared that?
I felt so horrible for her. It's like the worst case of food poisoning or flu you've ever had. And for me, it lasted 8 months. And you can imagine how exhausted you are when that happens. So it's really severe and exhausting, and you feel miserable. I was glad she was getting the help she needed early. Obviously, she has the resources to do that, but I was glad her doctors were taking it seriously.
All right, thank you so much for joining us, Kate. And is losing 30 pounds, would that be something that's pretty typical?
That is very atypical in pregnancy. Typically, we have people gain 30 pounds. They'll maybe lose a few, so definitely sounds like she was one of those unlucky few.
All right, thank you very much, doctor. So, what to think of all this? We're going to be having daily updates, I'm sure, Scott, on Kate's condition, because everybody in London is following this, and all over the world as well. Back to you.
Story gaining a lot of buzz around the world. Thanks, Ann. Baby Cambridge certainly pushing its way into the line to the throne before it's even born. Before the announcement, this is what it looked like. Prince Charles, then Prince William, then Prince Harry. But with the new baby in the mix, it pushes Prince Harry back, and regardless if it's a boy or girl, the new baby will take over the spot as third in line for the crown. So very exciting things happening there.
Yes, it is.